Hi, this is Connie Haxby, licensed clinical social worker, and today I wanted to discuss what to expect in your first couple of sessions with a therapist. A lot of times, first time patients will come in, and it's kind of intimidating to go into a situation and you're not quite sure what to expect. And there's a lot of, I think, bad information out there as far as when we look at the way that therapy is portrayed in the media or in some movies, or even just stigma around mental health services and mental illness and things like that. So I wanted to give kind of a clear understanding about what to expect with treatment the first couple of sessions. So after you make your appointment with a therapist, when you come in, typically you're going to fill out some paperwork with your therapist. So demographic information is going to be on that paperwork, as well as what we call informed consent. And an informed consent is basically just sharing with the patient, what it is that we're going to be working on, the type of treatment modalities that could be used, any sort of things that you're going to get out of treatment, the benefits to it, the risks of treatment. Sometimes things get more emotional. We call it kind of getting better before it gets worse. With some patients, we're bringing out some things that haven't been talked about in a really long time, and that can bring up some emotional pain. So just having to be aware that that could be a part of your process. So things like that. We're going to go over things such as treatment planning, things such as cancellation policies, what our fees are, boundaries with your therapist, things such as that. So that's what to expect in the first couple of sessions with your therapist. A lot of sessions for your first session is going to last about an hour or so, and that's typical of most therapy sessions. So just be aware of that as well. So when you come in, after you fill out all the paperwork, sitting down with your therapist, some of the questions are going to be, why are you seeking treatment now? What's happened more recently? Why now as opposed to 6 months ago or a year ago? History taking information. At least on my end, I like to take down a lot of history from my patients, because I want to know where you're coming from. I want to know what kind of a household that you grew up in. So much of who we are as individuals has everything to do with how we grew up. So much of the way that we view things has to do with our experiences. So I'm going to want to know, what kind of household you grew up in, if there's any kind of trauma, either big T trauma or little T trauma. We've talked about that in other videos. If you grew up in a household that was loving and comfortable, or was it, chaotic, abusive, neglectful, things that happened in school, what kind of a student you were, have there been any issues related to bullying, things of that nature. I'm also going to want to know any specific events that have happened in your life that could have been detrimental to you, maybe things that stick out to your mind. Again, not just talking about traumas, but even good things, positive things that have happened in your life, because I'm going to want to know that as well. Beyond that, what we're going to talk about is something called treatment planning. And treatment planning is when we say, okay, so this is my understanding about what's going on with you. This is, these are the things that we're going to work on specifically, and this is how we're going to do it. There's no specific definitive timeline as far as how long treatment is going to last or should last. I always tell folks, don't expect it to be like you go into the gym. So if you go into the gym, 5 days a week, then you're going to see those results quicker. Just because you go to therapy more often doesn't mean that you're going to see results quicker. It's a process. We're not trying to fix things. We're not trying to cure things. Those things don't get fixed or cured. We manage things. We make things better. We teach you how to respond to things better. We teach you how to gain the confidence to be more assertive, so things like that, mood stabilization, behaviors, and things that are going to help you manage your life better to make things happier and healthier for you. In conjunction with medication, sometimes that's also something that we need to look at. Keeping in mind that therapists do not prescribe medication. We are not medical doctors. So if you need to go to your primary care physician or a nurse practitioner or psychiatrist for that, that's something that we, would probably be on board with, considering, whatever your circumstances are. You get to make that decision, but that would be something that we would want to be in on, as far as knowing what medication you're taking and for what. So those are the things that you're going to want to just be expecting in your first couple of sessions of therapy, history taking, all the formality paperwork and things such as that we have to get from you. And then going beyond that, you and your therapist will work on the actual treatment planning phase of things. That's going to be different for each person. Whenever I have someone come in, I always ask, what do you want this to look like? Do you simply want to come in and process, stressors that are going on in your life right now? Do you want to work on specific goals, that we want to maybe take one or two things that we focus solely on? Or is this simply something that you want to come in and have someone to kind of vent to and share with and process with? We want to know what that looks like for you, because we want to make sure that we're doing everything we can to get you to a better space, okay? So keep those things in mind. Of course, every therapist might do things a little bit differently, but those are pretty much, across the board, the things that most therapists, if not all therapists, do. So go into it with an open mind of that's what to expect. Please, please, please write down any questions that you have for your therapist and go over those with that therapist, because we always want to make sure that we're doing the best thing for you and your care. Until next week, have a great day.